Imagine living a life in fear of your own reflection. The mirror is your worst enemy. Society has labeled you a narcissist, told you to get over yourself, made your illness an illusion, and a product of vanity. But what if you were 1% of all North Americans to be diagnosed with a disease that is in fact real and does exist? Body dysmorphic disorder, known as
BDD was first described by an Italian psychiatrist, Enrico Morselli, as dysmorphophobia in 1891. What does that mean? The term was derived from the word dysmorphia, a Greek word meaning mishappenness or ugliness. For many years, body dysmorphic disorder was disregarded as an anxiety, depression, self-obsession, or another psychological disorder. However, as recently as in 1980, BDD was formally diagnosed by the American Diagnostic and Statistical Manual as a type of atypical somatoform disorder. But what does that mean?
Explanations were still unclear. It was certain that BDD was the closest and most recent disease that was related to obsessive-compulsive disorder and could possibly be heritable. Intricate research by psychologists suggested that it could be traced to pre-existing emotional trauma, sexual abuse, or parental neglect experienced. But what exact symptoms did BDD entail? BDD is a condition where one is subject to excessive concern over either a very minor or completely imagined flaw in one's appearance, not simply restricted to weight or body fat, but also leading to distress in functioning. A fear of deformity, also known as imagined ugliness. Picture each of your insecurities: big hips, long arms, crooked nose. These may seem trivial, but people with BDD will go as far as picking 5 to 7 body parts which they resent for the entirety of their life. Low self-esteem, shame, and unworthiness are also symptoms of this disorder, causing individuals to think that others are constantly pointing out their flaws.
You might think this is purely psychological, but BDD's correlated symptoms suggest otherwise. Victims are subjected to skin picking, restrictive eating, frequent mirror checking, or the polar opposite of avoidance, outfit changing, or even excessive grooming. Not serious enough? Well, 21% of BDD-affected participants in a recent study done by UCLA have gone under the knife to mold themselves into their idealized self-vision. Even more disturbing, over 25% of people report that they are unhappy with the results. BDD is an endless burden that follows you wherever you go. Its severity can wax and wane and follow its affected individuals from a school environment to the workplace and most prominently in a social setting. Most frightening, the distress of BDD can lead to suicide.
So how is BDD diagnosed? Correct diagnosis calls for specialized questioning and correlation with emotional distress or social dysfunction. In order for people to receive accurate diagnosis and appropriate treatment, patients must specifically address and be transparent with their concerns of their appearance when speaking to a doctor and/or mental health professional. In fact, research has proven that in patients with BDD, the brain center for processing holistic information is underactive. When testing with the fMRI, it was shown that the entire structure of the face is not properly recognizable by the brain. And speaking in clinical terms, recent studies have shown that individuals with BDD may have perpetual perceptual distortions as they perceive defects in their appearance that are not observable or appear minor to others. These observations, in addition to above-mentioned neuropsychological findings of aberrant visuospatial processing, suggest possible disturbance in visual perception and/or visuospatial processing.
But there are some options available for those to seek therapy. Antidepressant medications such as serotonin reuptake inhibitors, known as SRIs, and cognitive behavioral therapy, CBT, are considered to be effective, although no complete cure is available as of yet. If you or a loved one is diagnosed with BDD, there are non-medical methods of managing its effects. Try expanding your ideas of beauty, taking a look at things such as the local art galleries or the libraries. Try to find what makes things beautiful and what you want to appreciate in them. That's not up for you? Try joining a support group. It may be helpful to share your experiences with people who are going through similar situations. Not up for that either? Try writing some of your feelings down in a journal. Or try writing down some positive affirmations. Put positive notes around the house, or carry them with you. Anything like, I'm okay as I am, or even, I am worthwhile. BDD is not a self-conjured obsession, nor is it a fake diagnosis. It is in fact a true disease that affects many people. The disease is even still left open-ended. It's quite subjective to diagnose and is currently open to future exploration. But just remember, beauty is in the eye of the beholder. If you can change your perception, you could change your life.